Welcome to Roughing It with Ruth, the channel where everything is a bit rough around the edges. I just wanted to do a quick update video on what has been going on with my skin cancer situation and my Mohs procedure. As you can see, I have a scar on my forehead, and that is from the Mohs procedure where they cut out the basal cell carcinoma that I had, and that was about 2.5 months ago. And I think it's actually healed really well. I'm not wearing makeup or anything at the moment. I'll show you a close-up of the scar. It is quite long. It extends from about here all the way back into my hairline to about here. And the reason that they had to do it that way is in order to close the large chunk of skin that they removed to get the basal cell carcinoma out. And I do think that the scar is probably also going to fade a bit more even. I've been rubbing some bio oil on it twice a day as they recommended. So I'm pretty happy with the results now. But I do just want to mention, if you are having the Mohs procedure, I did find the recovery from the Mohs procedure kind of challenging. I was very focused beforehand on the procedure itself and what was going to happen on the day, and I did a whole lot of research about what was going to happen. But the part that I actually struggled the most with was after the procedure, when I got back home and all of the lovely local anesthetic that they'd given me wore off. And I then had to kind of deal with the pain from having the basal cell carcinoma cut out, and also just having to deal with my altered appearance. At first, the first 2 or 3 days, I had a bandage stuck over the incision, so I couldn't even see the incision. But I did have a bit of swelling that kind of migrated down my face and made my one eye a little bit puffy. So I was looking a little bit strange for a while. And then when I could eventually remove the dressing and take a look at the incision itself, it was the first time that I'd seen the incision at that point. And that was quite a shock to me. I mean, I knew that a plastic surgeon was going to close it up, and everyone had told me, they're going to do such a good job and you don't have to worry about it at all, which is true. But it's also true that that sort of stuff doesn't happen immediately. And I mean, that seems like common sense, but in my head, I think I just kind of skipped all the way to the end where everything is healed up and it's all perfect, without really accepting the fact that I am going to have a fairly large wound on my head for a while with incisions and staples in it. And it is going to be very obvious to everyone that I come across that I have had something happen to my face. I think just keep that in mind if you yourself are going in for a Mohs procedure or some other kind of plastic surgery on your face. Then the other thing that was also quite difficult to deal with was just the pain. The pain after the procedure was a pain that I hadn't really dealt with before, because it was a kind of tension pain. They obviously had to pull the skin fairly tight to get it to close. And for me, it was like wearing a hat that was too small, but you can't remove it. And I did take painkillers and so on, but they were not necessarily great at completely eliminating the pain. They did help, for sure. Even when there wasn't a sore feeling, I could still always feel that tension, that kind of like pulling feeling. And that was very uncomfortable. But after about, I want to say maybe 4 or 5 days, that started to dissipate as well. And now it really is not painful at all. The wound is not painful. The rest of my head is not painful. So I'm feeling pretty good about it. And I do have a follow-up appointment with my dermatologist at the beginning of December. And she's going to just check all of the rest of my skin as well. Since I have had this basal cell carcinoma, I do want to make sure that there's nothing else going on. And I would highly, highly recommend that everybody gets checked out at minimum by your GP, but possibly by a dermatologist if you have a history of skin issues in your family, because the sooner they catch these things and deal with them, the less difficult it is. If you wait and wait and put it off, then sometimes the lesion can get really large, sometimes it can infiltrate the structures around it, and sometimes it can actually metastasize to other parts of your body, depending on the type of skin cancer you have. I know it is scary, but it is the right thing to do, and in the long run, it is 100% going to help you far more than just putting it off and putting it off and putting it off. Thank you so much for watching this video. If you would like to see more from me, then you can click on my channel name to see videos that I've made in the past, or you can subscribe to my channel to see videos that I'm going to make in the future.